Assalamualaikum. I'm Dr. Amara from MMK Hub. Today I'm going to give the lecture about the ovarian cyst. And the purpose of giving the lecture is that we can make your concepts more clear. Ovary. Normal size of the ovary is 5 into 3 into 3 centimeters. And if we consider it in millimeters, then it would be 50 into 30 into 30 millimeters. Variation in dimensions can result from different reasons, like if there is endogenous hormonal production, it varies with age and menstrual cycle. As all of us know that hormonal effects on the uterine walls causes the difference in sizes and thickness of the wall of the uterus. Exogenous substances including PCOs and gonadotrophic releasing hormone agonists or ovulation inducing medications may affect the size. These are the exogenous substances. These are those hormones which are synthetic hormones, and they are introduced externally but they can affect the uterine wall and their size. And further, how will we investigate for different ovarian cysts? To confirm our diagnosis after the examination, first we will go for the ultrasonography and then tumor markers, straight X-ray abdomen, paracentesis and laparoscopy. Now we will discuss in detail the different investigations and the findings found during the investigation. Ultrasound scan. Scanner probe, that is transducer, is placed on the abdomen or where the ovaries are. Sometimes the probe may be placed inside the vagina, that is the TVS. In TVS we place it inside the vagina, which gives the clear image of the cyst and the lesion. Blood test. Blood tests include CA-125. High CA-125 levels could also mean the patient has ovarian cancer. This is the picture showing ovarian cyst on ultrasonography. The size of the cyst is enlarged. It's anechoic and it's showing the wall of the cyst and whether it has septations or not, whether it has the low level echoes or not. All these things are seen on the ultrasonography. In benign lesion, there are less chances of the low level echoes, that is hemorrhagic cyst, in which we can find the low level echoes. And in malignant lesions, we will find a mass inside a cyst and different other septations, thick wall and all that stuff. I am studying it. Other investigations include pregnancy test and laparoscopy. The differential diagnosis of the ovarian cyst include full bladder, pregnancy with fibroid, ascites, fibroid uterus, and cystic peritonitis. Now the treatment. The treatment guidelines include several factors are taken into account when deciding on the type of treatment for ovarian cyst and whether to treat at all. The main factors are the patient's age, whether the patient is pre or postmenopausal, the appearance of the cyst, the size of the cyst, and whether or not there are any symptoms. The treatment. The treatment is the observation first. Sometimes watchful waiting, known as observation, is recommended. If the woman is premenopausal and she has a small functional cyst 2 cm to 5 cm, an ultrasound scan will be carried out about a month or so later to check it and keep on follow-up. Birth control pills. These reduce the risk of new cysts developing in future menstrual cycles. Management of functional cyst. Expectant, watchful, waiting for 2 or 3 cycles is appropriate. Combined oral contraceptives appear to be of no benefit. Should cyst persist, surgical management is often indicated. The surgical treatment. In young women, ovarian cystectomy, oophorectomy, salpingo-oophorectomy. Paraspomin, total abdominal hysterectomy plus bilateral salpingo-oophorectomy. Others are the individualization, and the options are laparoscopic cystectomy, ovariotomy, laparoscopy, ultrasonography, guided aspiration of the cyst. Further treatment that is surgical includes, if there are symptoms, the cyst is large, does not look like a functional cyst, and is growing further or persists through 2 or 3 menstrual cycles, the doctor may recommend the patient have it surgically removed. Laparoscopy is the keyhole surgery, and laparotomy, this is more serious operation and may be recommended if the cyst is cancerous. Complications of the ovarian cyst. The first and the most dangerous and the common is the torsion, intracystic hemorrhage, infection, rupture, malignancy, pseudomyxoma peritonei. The complications are further discussed, like torsion, which is 10 to 15%, moderate size and weight, free mobility and long pedicle, common in dermoid or serous cyst adenoma. Causes can be trauma, violent physical movement, contraction of the pregnant uterus, intestinal peristalsis. Rupture. Commonly occurs with corpus luteal cyst. They involve the right ovary in 2/3 of cases and usually occur on days 20 to 26 of the woman's menstrual cycle. This is all about the ovarian cyst. Now, what is the summary of the take-home message? There is no definite way of preventing ovarian cyst growth. However, regular pelvic examinations, which allow for early treatment if needed, usually protect the women from complications. Although most cysts are harmless and go away on their own, healthcare providers will want to keep track of any cyst to be sure that it does not grow and cause problems to the patient. Healthcare provider must explain female patients about significance of early diagnosis, treatment options available, and follow-up visits for ovarian cyst. Thank you so much. That's all for the today's lecture. And if you have any queries, you can contact us on the website and WhatsApp group of MMK Hub.